As we get started, I really appreciate everyone putting your names and pronouns and then where you're from in the chat just to go over some housekeeping items today. I'm really excited for you all to be here. Today, we are joining with SAFE to talk about serving survivors in the homelessness response system. And as we're doing so, please make sure to keep yourself on mute just so that your audio doesn't kind of co-smash with someone else's, and that everyone can hear and be able to participate in the training as best as they can. We will be doing a Q&A at the end of this session. So if you have a question and you put it in the chat box and we're not able to get it to it immediately, we will have that session at the end to be able to kind of address that. And if it's a longer question where some resources are needed or something like that, SAFE is offered to add additional support to make sure that question gets answered afterwards. And then for people who are here but will not be able to attend the full session, we will be recording this and emailing it out for future use later after the presentation. So I'm really excited, and I'll go ahead and pass it over to SAFE. Thank you, guys.
Thank you, and good morning. Hi, all. My name's Erin Goodison. My pronouns are she, her, and I'm the Senior Director of Housing at SAFE. Go to the next slide. And I don't have to talk a lot off the bat, which I'm grateful for. And it's okay if y'all are grateful for that as well. My mandate to start us off is just, why is this important? Why are we talking about serving survivors in the homeless response system? Next slide. So survivors of domestic violence, sexual violence, human trafficking, child abuse, and other related forms of abuse and exploitation are facing a lot of really complicated barriers to addressing both their safety needs and their housing stability needs. Those barriers encompass safety, housing, and the reinforcing cycle of homelessness and abuse. We certainly know that abuse and exploitation is a leading cause of homelessness nationally and locally. And we also know that those who are experiencing homelessness are so much more vulnerable to repeated victimization and different types of abuse, making it doubly, triply, and exponentially harder to escape these cycles. But what we want to make sure to touch on today is how this is also an equity issue and other types of oppression around race, gender identity, disability, immigration status. All of that also can worsen abuse, increase the risks of serious violence, injury, or death, and create additional barriers to accessing safety, accessing justice, accessing housing. But fortunately, there is a video that we can look at that is more eloquent than I am. So thank you, Lyric, if you'll take us to the video real quick. Are y'all getting sound?
No sound.
It worked just a few minutes ago, but this is my curse. I have this effect on technology sometimes. Thank you for your patience. Just a quick moment while we resolve.
Okay, let's try this again.
Thank you, Lyric.
Homelessness is an issue that far too many people face.
Yes.
People of color, specifically Black people, other...
Sorry about that. Oh, okay, there we go. There we go.
Homelessness is an issue that far too many people face. People of color, specifically Black people, other persons of color, and Indigenous people, experience homelessness in a dramatically different way than their white counterparts. People who hold multiple identities, such as those who live at the intersections of disability, immigration status, sexual orientation, gender identity, and more, experience compounded barriers that further homelessness and housing instability. A recent study found that 66% of people experiencing homelessness were Black, while 28% were white. Black individuals are only 13% of the US general population, compared to 74% of those who are white. Rates of homelessness within Native communities are 3 to 8 times higher than that of the general population. In total, 78% of people experiencing homelessness identified as people of color. This overrepresentation of Indigenous, Black, and other people of color experiencing homelessness cannot be explained by poverty or identity alone. Structural racism, historical policies, institutional practices, and cultural narratives that perpetuate racial inequity put people of color at a disadvantage in obtaining safe and affordable housing. Statistically, women of color are much more likely to experience domestic and sexual violence, and survivors often face network impoverishment. Network impoverishment occurs when the addition of a financially distressed household member places an extra strain on family resources. Oftentimes, we tell a survivor experiencing homelessness to go to a relative or friend's house. However, network impoverishment can cause immense burdens on the existing limited finances and available support from that network. Racial disparities arise at every juncture, from the legal system to housing, to healthcare, to child welfare, to public benefits. Understanding the intersections between domestic and sexual violence, racism, and homelessness, and applying an equity, survivor-centered lens in our work is the only pathway to stability, safe housing, and healing for all survivors. If we want to address racial inequity, we have to acknowledge it, learn about it, and talk about it, so we can do more about it together. To learn more, visit safehousingpartnerships.org.
Thank you, Lyric, and thank you all for your patience. Next slide.
I swear, man, technology is just not having it today.
We're just going to have to be patient with ourselves and technology, our technological overlords.
Okay, let's try this again. Okay. There we go. Perfect.
Thank you. Feel free to share the video, use it in your own trainings and presentations. Safe Housing Partnerships has given explicit permission to share widely in hopes of raising awareness and increasing our commitment to do work around racial inequity and incorporate it into how we address both homelessness and abuse. But also want to make sure we know how much this relates to our work locally in Austin and our continuum of care. So I believe the last big overview available on ECHO's website is from 2020, but at that point, 72% of those experiencing homelessness locally reported that abuse and trauma was the cause of their homelessness. So that's nearly 3/4 of those who are reaching out, contacting the homeless response system, attribute their homelessness to abuse and trauma. And since 2017, we've really consistently seen that 45% or more of all of those who complete coordinated entry or assessment in Austin across all providers report that they are survivors of domestic violence, sexual violence, human trafficking, or a related type of abuse, and often are actively fleeing abuse. More recently, and very distressing, in 2022, the demand for confidential coordinated entry through SAFE tripled. Our numbers were pretty steady around demand of households that were fleeing or attempting to flee abuse, experiencing homelessness, and were also survivors wanting the confidential option for coordinated entry. Pretty steady numbers in 2020 and 2021. And they doubled at the beginning of 2022 and increased so far that by the end of the May, they tripled from an average of 30 households a month over 2020 and 2021 to now more than 90 households reaching out. And the overwhelming majority of these households are having their very first contact. More than 90% over 2022 of households reaching out. This is their first contact with the homeless response system. This can be attributed to increases in abuse that we anticipated during the pandemic, when a lot of folks were quarantined, didn't have a lot of options for accessing safety and support, as well as the end of all of the various eviction moratoria that were maybe allowing people to remain housed longer. So yeah, there is a huge surge of newly homeless households trying to flee with safety needs and housing needs who are coming into our system. And though I am being kept up at night by those numbers, I'm very grateful that so many of you signed on for this webinar, because it shows recognition, investment, and commitment to trying to do this work. So thank you all for joining today. You can be done with me for a little while. I'm going to pass it off to the amazing Erin Clark to talk about identifying abuse, crisis response, safety, and a million other brilliant things. Thank you, Erin.
Thank you, Erin. Good morning, everyone. I am Erin Clark. I am the Senior Director of SafeLine. SafeLine is our 24/7 hotline, chat line, and text line at SAFE. We serve survivors of child abuse, sexual and domestic violence, and human trafficking, as well as their loved ones who want to know how they can be supportive of survivors, as well as take care of their own needs as helpers. A big part of what we do on SafeLine is provide admission screenings for our family shelter and our safe community shelter sites within Austin. We maintain a wait list of the folks waiting to access our shelter services. We work to connect clients to various safe and community programs, and we do a lot of safety planning. So let me tell you a little bit about our shelter screening process. Our screening for shelter tends to take about 15 or 20 minutes, and it allows us to gather information about the type of abuse that someone is experiencing, as well as understand their lethality risk by using the Campbell Danger Assessment. When space becomes available in our shelters, we admit clients from our wait list that have the highest risk of being killed. That determination is a combination of the Campbell Danger Assessment score, resources that are available to clients to become or remain safe, and consideration of barriers that clients identify put them at additional risk. One good example of that is that not everyone is safe to involve law enforcement in a violent incident, and it's important that information like that also be factored in. About 20% of all calls to SafeLine are requests for shelter. The remaining 80% of calls are from folks wanting many things: support following sexual assault and weighing if they would like to involve law enforcement or if they would like medical care. We have many services available at Eloise House, which is our on-site clinic that folks can access through SafeLine if they would like a forensic exam or medical exam that does not involve law enforcement. And of course, all of our services are free. We make lots of other referrals to SAFE and community resources. One of the biggest referrals that we make are legal resources related to violence. We make many referrals every day to legal resources to help survivors with issues such as divorce, custody, protective orders, etc. We work really closely with Legal Aid, Texas Advocacy Project, LASA, which is Legal Aid for Survivors of Sexual Assault, Texas Legal Services Center, and Allied Legal Services, in addition to referrals to our SAFE Legal Department. In addition to referrals to our SAFE Counseling Department, which offers individual counseling and support groups, we also make referrals to our peer support program at SAFE that offers healing modalities, shared life experiences, and creation of supportive networks with survivors on staff who have experienced violence. On SafeLine, we also offer in-the-moment parenting support. We explore nonviolent parenting strategies and make connections to our various parent education programs, such as Strong Start, Safe Futures, our Fatherhood Specialist, etc. On SafeLine, we make referrals for coordinated assessment. If a caller is experiencing homelessness and has not experienced domestic violence or sexual assault, we connect them to the ECHO website that shows different coordinated assessment locations in Austin. If they are recent survivors are experiencing homelessness and extra care is needed to protect their anonymity and safety, we connect them to our safe coordinated entry specialist to provide coordinated assessment. Safety planning. Safety planning is something that we offer in some way in just about every call that we take on SafeLine. Safety planning can take on many different forms, and by creating and refining a safety plan, folks can already have a plan in place of what action they would like to take in certain circumstances, and those plans can be tailored to each person's unique circumstances. Safety planning includes many things, such as determining if someone feels safe contacting 911, and if they don't feel safe involving law enforcement, exploring if there are other ways that they could be safe in a violent incident, maybe exploring what they've tried in the past that was useful. We explore how to stay safe if you're planning to leave an abusive relationship, or how to stay safe if you're planning to stay in the relationship. Safety planning can include thinking of things to bring with you if you decide to leave, identifying a few options of where you could safely stay if needed, as well as people you know that are ready and willing to offer help. As advocates, it's really important that we do not see ourselves as the experts providing a client with the answers of how to be safe. Instead, our role is to create a safe space where clients feel comfortable exploring what has and hasn't worked before, identifying new resources that they had not previously considered, and maybe even practicing a run-through of how they would like to respond in various situations and what they would need to be able to do so. A really common safety planning scenario that we often discuss on SafeLine is how to stay safe in an abusive relationship. And certainly this is not everything that could be discussed, but these seem to be the highlights of what we often share with folks. Some things that we might discuss when creating a safety plan for remaining in an abusive relationship are encouraging the survivor to learn about the cycle of violence and to trust themselves when they notice signs of impending danger or abuse. They're the experts in their situation. Encouraging clients to prepare themselves emotionally for how they will handle their partner's apologies and promises to change following an abusive relationship. Working with a client to identify safe spaces in their home where they could try to move during an abusive incident, maybe away from knives or glass or where any weapons are located. Maybe they could move towards a location with phone access where they could call for help, or somewhere where they could even barricade themselves in that space if they needed to. Survivors have shared with us that at times it has been helpful to consider giving the person using abuse against them what they want or what they need to calm down, if they know that this has worked previously, or if they have an idea of something that might work. We talk about considering if it would help to talk with their children or maybe neighbors and instruct them to call 911 if they see or hear violence. And we always want to remind everyone that they are not to blame for the abuse, that they did not cause the abuse to happen, and that they don't deserve to be abused. Another type of safety planning that we provide on SafeLine is for folks sleeping outside. And so much of this information came from the publication entitled Staying Safer on the Streets by the Victim Rights Law Center. It was really amazing. So that, combined with feedback that we have gotten from clients previously, has informed us in how we safety plan with folks who are sleeping outside. As Erin mentioned before, it's important that we know that domestic violence and sexual assault results in trauma that destabilizes the lives of survivors and increases their chances of becoming or remaining homeless. Those already experiencing homelessness are especially vulnerable to domestic violence and sexual assault. So some of the things that we might want to discuss with folks are around the privacy measures that we take when we are providing services to them. Many sexual assault survivors report that they're tremendously concerned about their privacy, and they may not feel comfortable really telling anyone about the assaults, even if their decision limits their access to advocacy, legal assistance, housing, or other help. For instance, survivors experiencing homelessness may decide not to report an assault to police, friends, family, or service providers because they could be afraid that they will not be believed, or they fear they might be blamed or even punished for what they were doing at the time of the assault. For example, drinking, using illegal drugs, loitering, sleeping in a public place, or trading sex acts for money, food, or shelter. Certainly, we know and understand that no one is ever to blame for abuse that they experience, regardless of what they were doing. In addition, survivors experiencing homelessness may feel unsafe talking about the assault, as they may live, travel, or be in a relationship with or seek services in close proximity to the perpetrator. It's important to discuss with survivors who will have access to the information that they share with you, and to be very clear about mandatory reporting requirements that you have. Individuals experiencing homelessness are often forced to choose between two or more potentially unsafe or dangerous options, such as opting to sleep alone or with someone who provides safety on the street in exchange for sex acts or some other form of currency. Managing threats to a survivor's emotional safety and well-being can be as important as addressing physical safety concerns. You are in a unique position to create an environment in which survivors experiencing homelessness feel safe enough to share their fears and supported enough to take steps to minimize risk of future harm. So again, this is not all inclusive, but some questions that can help with safety planning, especially when folks are sleeping outside, are exploring how someone can be safer at school, at work, other places they might frequent. How can they be safe using technology? How can they be safe with their emotions and feelings that are coming up? What can they do to increase their safety when using drugs or alcohol, when they're sleeping outside, when they're on the street, or when they're in transit? In all of these areas, it can be helpful to ask, what is working and what is not working for you? What has helped and what hasn't helped? Ask about when have things been better and when have things been worse, and try to have a conversation about what are some little fixes that could be put into place, which are some short-term changes, as well as some what are some bigger fixes that might take more time, involve multiple steps and additional effort. It's good to ask what will help, who will help, and then come up with a plan for next steps. As a service provider, it's important to be mindful that you should be available to safety plan and support clients who have become housed and a person who has used abuse against them has moved in with them. Keep in mind that a client may be fearful or hesitant to share with you that a person that has used abuse against them has moved in for fear potentially of being punished, losing access to the resources, maybe even thinking that staff might lose respect for them. We need to let our clients know that we are not here to judge them, that we believe that they are in charge of their lives and are in the best position to decide what is right for them. We want them to know that we understand the cycle of violence and that it's human. We all want our relationships to work. We want to give people we love a chance to change. That's normal, and so we understand. And I encourage everyone to always be looking for ways to screen in for continued services and resources and not screen folks out of services. A few more quick things before I pass it on to Karem. It is perfectly okay, and we even encourage folks to call Safeline on behalf of a client. You know, reaching out to a stranger to talk about your needs and what you've been going through can be really terrifying. And it can often help a client feel more comfortable if someone calls Safeline for them prior to their calling to kind of pave the way. We know that it can feel really welcoming for a client to know that an advocate on Safeline is expecting their call, or maybe even give the name of the advocate to the client so they can feel comfortable asking for that person. We understand that many folks might not have access to being able to call or text or chat in to our Safe line. So for folks that want to connect with Safe or Safeline, but they don't have that access, please know and share that we have walk-in support Monday through Friday, 8 a.m. to 4 p.m., where an advocate at our resource center can provide crisis intervention and connection to safe and community resources. And with that, I will pass on to Karim Castillo.
Good morning, everyone. My name is Karen Castillo, pronoun she, hers, and I am SAFE's Coordinated Entry and Navigation Manager. Next slide, please. So as Erin has stated, SafeLine provides 24-hour services, whether it's through phone call, chat, or text messages. And they also provide walk-in services during open office hours. SafeLine is a great resource that can be utilized as a starting point to inform, educate, and refer people who are in need of services or are needing help getting started while providing emotional support and resources. And some of these resources can be by being referred to safe programs or community resources. And another thing about SafeLine is that they're also able to refer any risk at homelessness or homeless individuals. I'm sorry, my screen just froze. 1 second here. Homeless individuals or families who are experiencing abuse and attempting to flee or fleeing for a confidential coordinated assessment. Next slide, please. There we go. Sorry, I'm having technical difficulties as well. So before I talk about what coordinated assessment is, I think it's important to mention that SAFE works closely with ECHO, and ECHO stands for Ending Community Homelessness Coalition, and they're the leading agency that plans and implements community-wide strategies to end homelessness in the Austin and Travis County areas. ECHO also administers a community-wide database called HMIS, which is the Homeless Management Information Systems, where all the completed coordinated assessments in Austin and Travis County are stored, and HMIS is also utilized by ECHO to distribute housing referrals out to the Austin Travis community organizations. So what is a coordinated assessment? A coordinated assessment is an assessment that screens, assesses, and prioritizes housing services for people who are experiencing homelessness by documenting about the barriers the person faces to being rapidly housed and any other characteristics that might make them more vulnerable while being homeless. The coordinated assessments are also completed by trained assessors that ECHO trains, and all of the completed assessments information is stored in HMIS, where the assessments information is visible to the Austin Travis County community. The coordinated assessments are offered throughout the Austin Travis community organizations, and if you are interested where these assessments are being offered in the community, then please go to the ECHO website where they have an updated list of community organizations that offer the coordinated assessments. Next slide, please. Yes. So earlier I mentioned that SafeLine is able to refer people for a confidential coordinated assessment with a SAFE assessor. A SAFE assessor is a SAFE staff that has been trained by ECHO to complete coordinated assessments. And a confidential coordinated assessment has the same process as the assessments that I just talked about earlier, but the part that makes the assessment confidential is that it is completed by a safe assessor that targets a specific population. And that population are people who are at risk of homelessness, or homeless individuals or families who are experiencing abuse and are attempting to flee or are fleeing. Survivors who are in abusive and dangerous situations have to take many precautions in safety plan as to when they're requesting help, as when living in an abusive home can lead to higher levels of danger and risk. Completing a confidential coordinated assessment provides survivors to request assistance without their personal information being displayed or entered in a community-wide database, in this case, HMIS. The way that this works is that when a person completes a confidential coordinated assessment, their personal information stays on Safe Alliance database, and then we de-identify that data and send it over to ECHO so that they can create housing referrals for us. So this means that people who complete confidential coordinated assessments at SAFE will have their information shown as anonymous in HMIS instead of their personal information being displayed. Another thing about confidential coordinated assessments is that it gives survivors a choice as to who has access to their personal information and who SAFE is able to share their information to. In a way, it's giving survivors their control back and letting them decide how and when they can be contacted once a housing program has received their referrals, or that we can provide them with updates. Next slide, please. So a little bit more about the confidential assessment process is that we provide services via phone, in person, and that is by request after establishing communication with the client, and in the community as well. Right now, we're currently at the Trinity Center during their Monday Woman Only days. And throughout the service provision, clients are provided with emotional support and are informed and referred and linked to SAFE and community services targeting their needs. As I was saying before, all of the collected coordinated assessments information will stay on the SAFE database, and SAFE assessors will become the clients and housing programs point of contact to help streamline communications between clients and housing programs. And again, all of the completed assessments have the same opportunity of receiving services as the completed assessments in the community. The only thing that is different is that their personal information is not in HMIS and are shown as being anonymous. If you know someone who is at risk of homelessness or is homeless and is experiencing abuse and are attempting to flee or are fleeing, then please refer them to our Safe Line, where they can call, chat, or text, or even do walk-ins to inquire more information about our SAFE services. Next slide. Oh, I think go back to the other one, please. There we go. That's the, yeah. So go to the other side. There we go. Thank you. There we go. So another thing that I also wanted to talk about is how we safety plan with unsheltered survivors who have completed a confidential coordinated assessments for outreach. And so when survivors are fleeing or are attempting to flee, it is not always safe to contact them at any time of the day. So while we are completing an assessment, we safety plan with the clients as to when it is the best time for us to make contact with them. And the reason we ask for this information is because we don't want to contact the client when their perpetrator is around. In most cases, some clients prefer that we contact them during the mornings. And that could be because that will be the only safe time to call, as their abuser is probably at work or out of the home. But there are times when perpetrators are unemployed, making it difficult for clients to be in a safe space to talk. So this is where safety planning with clients is important, as it helps them be somewhat prepared for any situations with, along with providing us with information to reduce any type of conflict or even increasing their danger as to who the client may be talking to on the phone or for whatever reason. For clients who are not always in a safe space to talk at home, we brainstorm ideas to find a place to talk. Sometimes it can be while they're waiting at the doctor's office, grocery shopping by themselves, they are on their way to picking up the kids from school, waiting at the bus stop, going for a walk to the park with their kids, or turning the shower on to muffle the sound of being on a phone call. But there could also be more clients who have phone restrictions, like being under the perpetrator's observation while being on a phone call, or having barriers to having access to a phone, either not being able to afford a cell phone or the service, or just not being able to charge the phone at all. So we also safety plan with clients to provide us with backup contact numbers if making contact with them is no longer a safe option for them. So some of those backup contacts can be trusted family members or friends who they keep close communication with, and they can serve as an intermediate person that can deliver or update information on the client. But even then, there are some survivors that don't have family members or friends that they can turn to for help, or even have cell phones. So the next steps are to brainstorm ideas of where it is safe to leave a message or reach out in the communication. And it can be locations that they frequent in the community or community staff that they work with and they keep contact with. And so we help clients identify a staff or a location in a community to serve as a backup contact. And once that has been established, we ask clients to provide us with the written consent that we can reach them through the community or through the community staff. And with the client's permission and consent, we reach out to the community backup contact and share information about the upcoming shelter information, housing updates, resources, and any other updates. Similarly, I will be serving as a point of contact to the clients in the community. So if there any questions or if I'm needing to facilitate communications between clients and housing programs or possible outreach, I can be reached at the coordinated entry at safeaustin.org, or you can also reach out through the Safe line where they'll go ahead and leave me a message for me to call you back or reconnect. And now I'll let Alyssa take over for the next section. Thank you.
Hi, all. So today I'm going to be talking about Vawa and housing safety and all of those things. So if you can go ahead and go to the next slide. So what are Vawa protections and how we're going to apply them are our agenda items for today. Next slide. My agenda is going to be as follows. I'm going to first give you a bit of background about myself and my work history within housing. I then will discuss how to incorporate safety planning into your housing search and placement work. Next, I will go over some Vawa basics before discussing how we at SAFE complete emergency transfers and housing relocations. And lastly, I will go over how to address safety concerns with landlords. Next slide. So who am I and why am I here talking to you? My name is Alyssa Edwards, and I have been with SAFE in some capacity since 2018. I started my work in housing as an AmeriCorps volunteer and then moved into a housing advocate before switching gears and working in housing placement. I'm currently the housing placement manager for SAFE's Rapid Rehousing team. My background is that I was born and raised here in Central Texas, and in 2019, I graduated with my master's in conflict transformation. I understand housing to be a basic human need, and as such, the deprivation of that basic human need is, in my belief, an act of violence we as society perpetrate against those experiencing homelessness. And that is the lens that I bring to my work. Next slide. So to start us off, I want to talk or discuss with you about how you as an individual and as a program can incorporate safety planning into your housing search. First off, what does that even mean? How do you incorporate safety planning into your housing search? Well, there need to be very specific questions related to safety in all housing questionnaires and meetings. Clients should be asked if there are people, places, or areas that make them feel unsafe. The goal is to try to work with the client to get them to narrow it down from North Austin is unsafe or South Austin is unsafe to specific zip codes or neighborhoods. Our basic housing questionnaire simply states what areas of town would you need to avoid for safety reasons. Moving into why. Why is it important to engage in these conversations with clients? It is important because we want our clients to feel safe in the housing we find. Also, if you don't allow for safety conversations, you can easily harm your relationship with your client. They can feel triggered by the options you give them and thus have their ability to engage with you affected. This can result in them ghosting you in the process, becoming hostile, or losing trust in you. And sometimes the lack of safety conversations can cause people to accept a unit that they rarely stay in, or one that they immediately need to remove themselves from using Vawa. Who should be engaged in these conversations with clients? Well, anyone involved in housing search or in client conversation. It is important for those who work with the client to have these conversations regularly, as the perception of safety is ever changing in people's lives. While a client is engaged in the housing search, it is important for the housing team to check in every 30 days to see if there are changes. It is important for the housing advocate to have ongoing conversations with clients around their safety. If either the housing team or the housing advocate notice that the client is declining a lot of units without real explanation, it is important for one or both to check in with the client and see if they are declining units out of a safety concern that has recently developed or that they didn't feel comfortable sharing initially. How can you incorporate safety information when you're having to deal with such a difficult housing market? I know that this housing market is extremely competitive, and it may seem like allowing clients to block off areas of town for safety reasons is just putting up another barrier between them and housing. This is why it is so important to have those conversations with clients that will narrow down their safety concern areas. Instead of avoiding all of North Austin or all of South Austin when searching for a client's home, ask them follow-up questions. Do they know a zip code, or can they give a landmark for a specific area in Austin that they are seeking to avoid? Explain to them that they don't need to give you the details of why they want to avoid that area, but if they could be more specific in the area they want to avoid, it will greatly help you in your housing search. Also, it is important to have real conversations with clients about the market and the fact that at some point they may be asked to choose the lesser of two evils. Is it safer for the client to have a place to stay, even if it is in an area they don't feel the most secure in? Or is it safer to remain in their current circumstance and wait for a different unit to come available? The only person who can make that decision is the client. Empower your clients to make that choice and trust them. Throughout the entire process, make sure that you and your program are not treating all client denials the same. A client who denies a unit because it is close to their former dealer or an area that they know their abuser hangs out in should not be equated to a client who denies a unit for non-safety related reasons, like they read a bad review or they would prefer a unit closer to family. If you feel a client is denying too many options for safety related reasons, always check in to get more specifics about the areas to avoid. Re-engage with them around the conversation of weighing their current safety level against the unit they are being offered. For our program, when we will sometimes offer clients units in areas they described as an area they wish to avoid. In those circumstances, we work to make sure the client knows that the only reason we are offering it is because the housing market is difficult and we want them to be able to make the safety decision. We don't want to make that safety decision for them. Sometimes the client will choose to move forward with the unit and the advocate will work with them to incorporate safety planning into their move. Sometimes the client will say no to the unit and inform us that they will never accept a unit in that area. At that point, we trust them. If they say yes, we do what we can to help them make their home as safe as possible. If they say no, that area is completely off limits, we trust them and no longer send them units in that area. Next slide. Now for the Vawa basics. The best place for you to get the most digestible Vawa information is on ECHO's Vawa page. The page itself has way too much information for me to incorporate all of it into this training today. If you have questions or if you find the page a bit too intimidating when you first open it, I would highly suggest that you start with the Vawa policy download that's towards the bottom of the page. And if you're interested, we can download that and send that as an attachment when we send out documents after the training. I think it's a great starting point because it gives you a lot of background information and it gives you links to the most important documents. One thing that I really do want to hit on before we move on to anything else today is the first little paragraph that I have included in the slide. So it's not so much like what the paragraph says, but what it doesn't say. So Vawa housing protections apply to all people regardless of gender. However, it does not apply to all housing. If you look at the last sentence, there is a line about it being extended to additional housing programs. This is why it is so important for your program to require any landlord they work with to sign a document acknowledging the client's rights to Vawa before the client signs a lease with them. If your funding is similar to ours, any client receiving funding is entitled to their Vawa protections. You will want to make sure that any landlord that you work with understands that and signs a paper agreeing to adhere to Vawa protections. Now, lastly, before we move into Vawa specifics, I want to acknowledge that every program has its own Vawa system. So please check with your supervisor about how your program specifically adheres to Vawa requirements, which are set by the federal government. Next slide. So one of the most important Vawa protections is that of the emergency transfer. As a SAFE program, we handle emergency transfers in the following ways. First, the client would discuss with a staff member, most likely a housing advocate, a safety concern that the advocate believes would qualify with Vawa. These are safety concerns that happen in or around the client's units. The client then works with the advocate to complete the standard emergency transfer request. The advocate then submits the transfer request, which we'll look at a sample of momentarily, but they submit that to their supervisor for approval. On our team, our director and senior director review all emergency transfer requests. While the directors are reviewing the requests, an acknowledgement form is sent to the client to confirm the receipt of the request. This form we will discuss more on the next slide, but it simply lays out that what we can offer as a program should the client's transfer request be approved. Lastly, a letter is sent to the client via their advocate that notifies them if the request was approved or denied. If the request was approved, the client enters into our housing search process. If the request was denied, the advocate works with the client to create a safety plan on how to address the concern they outlined without transferring their units. An important note about all VAWA-related documents is that they must be stored separately from all other client information. So these emergency transfer requests, the acknowledgement forms, everything should be at a place where people can't find it unless they have been brought into the housing process. Like, it's a need to know, and only those who need to know where the documents are. So any regular person should not just have easy access to that. Now, next slide. Now, looking at the forms, on the left, you have the emergency transfer request form. It's important to note that the client does not have to go into much detail here. The client only needs to share a sentence or two for most of the questions. And the client telling you of the incident is all the proof that's required. If the client has a police report they want to include, they're permitted to do so. However, it's not required for them to have a police report in order to seek an emergency transfer. On the right, you have our acknowledgement form. So the left is a form that was created and sent out by HUD. And on the right is our program-specific form for acknowledgement form. What this form does is outline what will happen if the client's transfer request is approved. It lets the client know the specifics that they have shared with us will be confidential. And it lets them know that they can request that we be the only point of contact with their landlords around emergency transfers. And that the landlord will be notified that the client is using their VAWA rights, but the landlord will not get specifics of why or how VAWA applies. The form also discusses the financial aspect of what we'll be able to cover in regards to the transfer, and ask for things like permission to use BOLO if they go out of contact and we're not able to get in touch with them. Should a client's emergency transfer request be granted, please know that the landlord does not have the right to know immediately. Please let me know if the noise outside is too loud and I'll relocate. I apologize. Obviously, there's another incident where each program has their own system, but I want to recommend that the property is not given the 30-day notice to vacate or vacate notice until the client has found new housing. The only exception I would list for this is if the client feels that their unit that they're currently at is not a safe place for them while they look for other housing. In that instance, you would help the client find transitional location and notify the landlord as soon as possible. If the client feels comfortable staying at their current unit, I would recommend not notifying the landlord until you have that other unit set up. If the emergency transfer is granted, the client starts in the housing search, and all of the previously discussed items of incorporating safety planning into the housing search come into play. If a client is denying a unit for safety-related reasons while they are on VAWA, please make sure that you are documenting that a unit was offered and was denied for safety reasons. It is important to be able to show that you as a program are taking the client's VAWA concerns seriously. So you will want to make note of what was offered to your client and when, and the result of the unit, the result of it. So either the apartment complex denied your unit or the client denied moving forward with the unit. If the client is declining a lot of units, you want to take that as a sign to check in with them. We typically do it around the 30-day mark. So if at that point you're noticing that there's not a lot of movement forward, you'll want to have a conversation with the client about what they're seeing. So now that they've seen and experienced what the housing market has to offer, are they still wanting to try and relocate out of their current unit? Or would they prefer to have safety planning conversations with their advocate to try and stay in their current unit and make it as safe as possible? And again, that's really up to the client and how they're feeling in that moment. Next section. So my last section for today is how to address safety concerns with landlords. Now, some pretty universal standards for conversations with landlords are as follows. It's always better for the landlord to come to us with their absurd, random, or ridiculous concerns than it is for them to take those to the client. And in this instance, I'm talking about things like a landlord's contacting you because they have a concern because your client is coming home at all hours of the night. It is the client's right to enter and leave their unit as they wish. And so it would be better for the landlord to discuss their concern around that with us than bringing it to the client and making the client listen to it. Secondly, landlords are not entitled to information about the client. They can share any information they feel so inclined to share with you, the client's advocate, but they are not entitled to you giving them any insight into why a client is acting in a certain manner. Which brings me to the golden truth of the less information you give about a situation, the better. You can ask a lot of questions, but don't provide information without the client's consent. In most instances, practicing active listening with the landlord will be enough to make them feel heard, and it will give you enough information to follow up on with your client about any ongoing concern. Landlords and 911. Landlords do have the right to call 911 if they feel they have a real and present fear for themselves or for another tenant. However, if a landlord calls you and mentions that they want to call 911 on your client, I encourage you to ask probing questions. Figure out if the landlord does fear for their safety, or if the landlord is feeling uncomfortable about something, and so they're wanting to bring someone else in. The next two slides are going to be incidents where a landlord may call you and mention that they want to call 911. I encourage you to chat how you would handle the situation if it were to occur to you. So next slide. So this first incident, the landlord calls concerned about the safety of the client and expressing a desire to call 911. As you gather information about the ongoing incident, you learn the client is seeing things in their room that the property has verified are not actually there, like bugs or insects or snakes, etc. The client gets angry and walks away when the property tells the client that there is no evidence of the items the client is describing. The landlord is concerned about the client's mental health and believes that professionals should be brought in. What do you do? Feel free to chat some. I'm going to relocate and then I'll be right back to talk about this. I apologize if y'all can still hear the background noise. So in this instance, if a property is contacting you and they're stating that they have concerns about a client, that they're saying that they see things that the property has proven are not there, I would encourage active listening at this point. Always going to the process of we will follow up with the landlord, telling them, oh, I'll have the advocate go out and check on the client, or we'll do this, but never explaining, oh, well, this is a mental health thing that this client has regularly exhibited, etc. So you'll just want to be there and listening to the landlord and practicing active listening and trying to de-escalate the situation so that they don't call in 911, which could be further traumatizing for the clients, as there is no immediate fear that the property has stated that they have either for themselves, for the client, or for any tenant. It's just a concern about mental health situation. Next slide. Oh, go back one, please. Second scenario, a landlord contacts you stating that they are concerned about your client and they want you to come to the property immediately. They say the client is yelling aggressively outside of the leasing office. The property manager has locked the office doors and expresses concern for his safety as the client is directing slurs and angry comments towards the manager directly. What do you do? Feel free to chat what you would do in this situation if you feel so inclined. This instance is different from the last, correct? Because in this instance, the manager does feel immediate concern for his or her safety, right? So in that instance, you will just tell the manager it is within their rights to call 911 if they feel like they are at a dangerous situation, if they fear for their own safety. Ways to de-escalate this would not be to show up at the property. I would encourage you, if you have a concern, to staff it with your immediate supervisor. We don't want housing advocates or people who are working within housing to feel as if they need to become first responders in a lot of incidents. So I'd encourage you to staff it with your supervisor, call the client, see if they answer, see if you can tell the client that the property is saying that they will call 911 and that the client should just walk away if at all possible. Those are potential ways to talk through and discuss the issue. But if the manager has expressed physical or concern for their physical safety, we cannot stop them from calling in emergency services if they so wish. We can say, I'm going to call the client right now. We're going to try our best to get them to walk away from the situation. So just know that's happening. And if you can get the client to walk away, and maybe that the manager no longer feels that need to call someone. Okay, next slide. So the final thoughts for my thing, yes, and Linda Jackson, you can definitely suggest them to call mental health services. If they wish, you can talk to the client and let them know that that's also an option. Best practice is always to, if the client answers the call, when you get a message like this from the landlord, try contacting the client. If the client answers, let the client know what's on the table for the landlord, and then let the client make an informed decision about what they're going to continue to do. Okay, if mental health services are on the table, if 911 is on the table, how am I going to react to that as the person outside of the door right now? And hopefully they will choose the right decision for themselves, and you at that point have done all you can as an advocate. So my final thoughts on Vawa and housing, this is super brief, very basic run through. If you have more immediate concerns or questions, please feel free to reach out. And I can send follow-up information as well. But my final thoughts are that the main goal is always going to be safety for all involved. So when we're talking to clients, we want to trust them when they say things make them feel unsafe. When we're going through forms that are required for Vawa or for rehousing, we want to trust a client's account of an incident and not require them to provide you with police reports or other items of quote unquote proof. And finally, when you're talking to landlords, you want to make sure that their stated desire of safety for their community and staff does not come at the expense of your clients that you house there. Being different does not equate to being a safety risk. And you just want to make sure that you as an advocate are doing what you can to help the landlord understand that difference and respond accordingly to whatever situation they find themselves in. And that is all for me. If you have questions, put them in the chat, and then I'm going to pass it over to Erin, who's going to close us out for today.
Hello again. Next slide, please. Hey, I'm back. And I just wanted to briefly touch on incorporating safety into all aspects of work between clients and staff. I've already heard from a lot of people smarter than me about different specific safety planning options at sort of all parts of the process. Next slide. But knowing that violence and abuse are epidemic in the culture at large and in our community, particularly those who are experiencing homelessness are experiencing violence and abuse at such high rates. And you really can't go wrong by making safety check-ins a part of your standard practice. Using universal precautions, incorporate this with everyone so that you don't have to try to guess when you might bring it up. It's just a normal part of the work, and it creates that aspect to your relationship, culture at large for your program and your client work. So checking in with your clients about their safety and comfort every time you have contact and prior to every home visit or meeting, and then adjusting accordingly. Like, oh, hey, I know we scheduled for a home visit next week. Is that still okay for you? Are you available? Everything safe, comfortable? I can still come. It can be fairly casual, but it's really nice to ask. And, you know, pause for a minute, give folks space to give an honest answer. It's just really, it creates an opportunity. And then when things do come up, again, you'll be able to adjust. Not feeling great this week. It might be someone in the household is sick, they're not feeling well, the air conditioner is broken. You know, there's a lot of reasons they may want to adjust, and just knowing that you're flexible with them is helpful. But it may also be safety staff. And so this is great. Incorporating safety check-ins on your team. So letting your supervisor and or a safe coworker know where you're going. It's a home visit day. The address and the contact info for each client's in my calendar. It's somewhere accessible. I'm going to text you when I'm on my way in and on my way out. If folks know, oh, appointments are generally an hour or 90 minutes, however long it might be, so that somebody's aware and paying attention. Like if they don't hear from you, they would know when to maybe be a little concerned, how to reach out to you, and if they can't get a response in a reasonable time frame, where they might want to go look and check in and see what's happened. Hopefully it's just that your phone battery died and you're having a bad day, but you know, creating the source of information and the practice that will help keep staff safe and also have them feeling hopefully connected to one another, confident about offering this service. And knowing if you get a bad feeling, if you see something concerning, if a red flag goes up, reaching out to your supervisor, reaching out to somebody immediately to staff it, discuss the risk and danger, and know how to adapt next steps, explore options. There's so much in that, but if you have it as a standard practice, again, it helps create a safer baseline for clients and staff all across the full range of our services. And then with handouts that we're going to share today, we have 3 different handouts on doing what's called mobile advocacy, often in victim services, home visits, right? Working with clients in the community, even though we know they have are experiencing abuse, and they may have particular safety concerns that need to be planned around and addressed, as well as the just standard practice things we can do for all staff and client safety. They are all in a nice PDF form. They can either maybe get dropped in the chat during Q&A, and or will be emailed out in the follow-up with all of these materials. But strongly encourage, if you don't already have a robust practice around this, looking at them individually with your teams and discussing what are some things we could easily incorporate that just might help make this a little bit more of our standard practice, increase everybody's safety. When we do all of these things, again, we can kind of help create a culture where it is normal to ask people about their safety and comfort. It is common for them to disclose when there's a concern or something comes up. And hopefully we're removing barriers to getting help or asking for what we need by just always doing this as a part of our practice. Next slide. And just a few other key points want to make sure to underline. It is absolutely okay to offer alternative services and service delivery options for survivors under VAWA, right? So HUD says if you're rapid rehousing, you have to require a client to meet with you monthly. You might need to require a home visit. Well, VAWA and HUD says it is absolutely okay to waive program requirements for home visits and other things when it's necessary for the safety of clients or staff. And what I would recommend is if you are making that adjustment, documenting the change in like your monthly plan form or service log, or however you track your service monitoring, discharge planning, whatever format you use for your program, just documenting you made a change for safety reasons. You don't need to put other details in besides that. You can certainly staff them with your supervisor or the team as needed. But for privacy and confidentiality best practice, if you say for safety reasons, that HUD auditor will get the idea. They see you documented, you made an adjustment, you should be good to go with that. You can offer the alternative service that best meets the safety and service needs of your client. And, you know, again, you heard a lot of great safety planning options, but that might include scheduling the meetings for where you both, client and staff, agree is safe and accessible. So do they prefer to do office appointment? Like, I can get to the office safely, but not a home visit. Do they need to meet you in a public place that feels safe and like, yeah, we can meet at McDonald's or Starbucks or at a navigation center, or even outside, maybe not in this heat, but at a location they say, yeah, I'm comfortable talking there. It's safe for me. It's accessible. I can get there on the bus. I can walk. We don't want to put an extra burden on somebody who's already going through a tough time trying to navigate abuse. Let's make it accessible. And that might mean also offering virtual services. If they have a safe phone access or a place they go where they have safe phone or computer access, and they want to do talking on the phone, a video call, texting, or email, if they identify that's what's safest and best, that's okay. Document that you did that for safety reasons. And again, you should be good to go. It's about trusting what they're telling us is safe and trying to still offer the best services that we can and really meet them where they are. What we cannot do, this is not okay. We're not allowed to terminate services or limit assistance to survivors because they're experiencing abuse. So if it's no longer safe to offer a home visit, we can't terminate somebody from the program because they can't meet that requirement. VAWA also protects survivors from being terminated for those reasons. So everything on the scale of balance is in the favor of finding a way to deliver services alternatively, incorporating safety needs, and just using those keywords around for safety reasons in your documentation. So you've got the reasoning behind it, you've got a justification, you're tracking it, but not disclosing a lot of personal information. And that, I believe, is it. Next slide for our key. So now we're to the Q&A, and it looks like some things may have been coming in from chat. And so I'm going to ask